The demographics of the nursing population show that as of 2008, 83.2% of the RN workforce is white, non-Hispanic, whereas 16.6% of the RN workforce is minority. This is because the predominant makeup of the U.S. population is white, non-Hispanic. I also think this is because there is a higher incidence of poverty among minority groups, making degree attainment more difficult. It also says that only 9.6% of the RN workforce is male, and the median age of the RN workforce is 46. The RN demographics show that there is not a very strong representation of nurses of minority backgrounds. Most nurses are white, females, around the age of 46. Also, most RNs have degrees at the ADN level, with the exception of the Asian population, which is at the BSN level. The demographics also show that 65.5% of the U.S. population is white, 15.4% are Hispanic Latino, 12.2% are Black, and 4.5% are Asian. This shows that the non-white population makes up 34.4% of the total population, which is a pretty significant number that is not receiving adequate nursing representation. The patient population is affected by this because there is a large and growing population of patients of different cultural backgrounds that are not being adequately represented by the nursing workforce. Partly because of the lack of nurses from minority backgrounds, but also partly because culturally sensitive and competent nursing care isn't often and thoroughly taught at the ADN level. We need more BSN or higher degree attaining nurses that are taught about different cultures and how to provide culturally sensitive care. The demographic of the RN population does impact patient care and creates healthcare disparities because the healthcare is lacking those with the needed knowledge to treat patients of minority populations. We are also in need of more higher degree attaining nurses that have the knowledge base to care for people of different cultures. We are doing these minorities a disservice in not providing adequate care by not being able to treat them as a whole patient. It's not enough to treat their ailments. We need to understand how their culture deals with, views, and understands their health and illness. In the article, Bring Diversity to Nursing, Recruitment, Retention, and Graduation of Nursing Students, the University of Massachusetts Lowell Department of Nursing developed the Bring Diversity to Nursing project, where they determined 4 objectives to help with this issue. First was that we need to improve access to the nursing profession by going into the minority and disadvantaged schools and recruiting students. Next was retention. It's important to keep the students engaged and focused once they have them. Next was to offer the students scholarships and stipends if they continued on with the program. And finally, this will lead to the graduation of diverse nurses that will be able to provide culturally sensitive care. I love all of this. If we can get more diverse students excited about nursing by teaching them what nursing can offer them as a career and offer them ways to achieve this, we'll be able to grow our population of diverse nurses in the workforce. In the article, Nursing in 3D, Diversity, Disparities, and Social Determinants, it makes mention that we can help eliminate health disparities by offering more funding and support to advance nursing programs. This goes along with my theory that we need more higher degree attaining nurses that receive more advanced education in the areas of culture and culturally sensitive care. If we are offering financial assistance to and other needed support systems to nurses who want to further their careers, we are growing more knowledgeable nurses. Along with this is that we will see more minority nurse scientists who can actively engage in health disparity research. This funding for higher degree attaining nurses seems logical. I believe that having nurses who are skilled in providing culturally sensitive care is important, and we should be actively working towards finding ways to make this happen. We owe it to our patients to provide the best, most well-rounded care we can give.